Hello, everyone. Let's talk about something that's on a lot of our minds. How do we take care of the people we love? Today, we're diving into a really powerful idea, reinventing healthcare by bringing it right into the comfort of home.
It's a question so many of us grapple with, right? You want the absolute best for your family, but the endless trips to the hospital, the stress, the waiting rooms, it can all feel so overwhelming. So, is there a better way? Well, the answer is actually a really powerful shift in thinking. Instead of always taking the patient to the hospital, what if we could bring the hospital's expertise and support system directly to the patient? That's the core idea we're going to unpack today. Okay, so what does this actually look like in practice? Well, it all starts with a rock-solid foundation of professional medical services. This is the first of three main pillars. And let's be clear, this is not about compromising on quality. Not at all. The goal here is to replicate a really high standard of clinical care, but in the one place where patients feel the most comfortable and safe, their own home. And we're talking about the real deal here. This means everything from doctors, including specialists like geriatricians, making house calls, to professional nurses who can handle IVs or post-op care. It even covers really complex stuff like advanced wound management. It's basically a complete clinical ecosystem right in your living room. Now, when you put it side by side with a typical hospital stay, the difference is, wow, right away you get rid of the stressful travel, and you seriously lower the risk of picking up a hospital-acquired infection. But here's the kicker. The whole experience changes. Consultations are more personal, they're not rushed, and that single difference has been shown to dramatically cut down the chances of a patient having to be readmitted to the hospital. That's huge. But, great healthcare is about so much more than just the medical stuff, right? So let's move on to our second pillar, which builds on that foundation. Holistic support for daily life and recovery. This is where the human element really, really shines. Because let's face it, recovery isn't just a medical checklist. It's an emotional journey, a physical one, and it requires supporting the whole person. And this part covers a huge range of things that make a real difference day to day. We're talking about compassionate caretakers who can help with things like bathing and getting around. It means having someone come to your home to collect diagnostic samples so you can avoid those tiring trips to the lab. And it includes essential services like at-home physiotherapy and palliative care, all centered on improving a person's quality of life. And the impact of this is just profound. Having a dedicated caretaker doesn't just lighten the load for family members. It gives the patient a sense of dignity and comfort that is absolutely crucial for their well-being. Or think about physiotherapy. When a therapist comes to your home, they can design a recovery plan that's not just tailored to your condition, but to your actual living space. This makes the exercises way more practical, and the whole recovery process becomes safer and, honestly, often a lot faster. All right, so we've got the expert medical care, we've got the holistic support. Now let's talk about the third piece of the puzzle that ties it all together, using modern technology to make healthcare smarter. And this right here is a total game changer. Instead of just waiting for a health crisis to happen and then reacting, technology allows doctors and caregivers to keep an eye on things continuously and spot potential issues before they turn into emergencies. So, how does something like remote patient monitoring actually work? It sounds complicated, but it's really pretty simple. The patient just checks their key vitals at home. Blood pressure, oxygen levels. That data gets sent digitally in real time to a monitoring system. If any reading is off, an alert goes off automatically. This means a doctor can jump on it right away and follow up, often long before a small problem becomes a big one. So, the big advantage here is pretty clear. For anyone managing a chronic condition, this means constant oversight and early detection, which leads to way fewer emergency trips to the hospital. Plus, when you add in things like secure electronic medical records and easy teleconsultations, the whole system just becomes seamless. So when you take these three things, the top-notch medical care, the day-to-day holistic support, and that smart technology, and you weave them all together, what you get is something much bigger than just a list of services. You get a whole philosophy of care. And this right here is the mission that pulls it all together. It's not just about treating sickness. It's about delivering care that is safe, reliable, and most importantly, dignified, while empowering everyone involved, the patient, the family, the caregivers, with the tools and support they need to succeed. Which really leaves us with one big question to think about. As our society changes and our healthcare needs get more complex, you have to wonder,
Is this integrated human-centric model the one that blends compassion and technology right where we live? Is this what the future of healthcare looks like for all of us? Definitely something to chew on. Thanks for joining me for this one.